Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care from Raleigh. Today I would like to explain three of the main reasons why people may need a corneal transplant. And remember, the cornea is the clear shield that covers the front of the eye. And in order to see clearly, the cornea must be clear and thin, and it also must have a nice smooth shape, because when the light is coming into the eye, this is the first part where the light hits the eye and the light becomes bent, and so it's very important for the clear vision coming into the eye. So one of the main reasons is if that cornea becomes cloudy. This could happen if there's a scar or a serious infection that may leave whiteness in the cornea where the light can't even really pass in very well. In severe cases of an infection, we may do a corneal transplant in order just to save the eye, because it may be getting thin or may even perforated. The next reason is if the cornea is swollen, the patients may need a corneal transplant. In order to be clear, the cornea must be nice and thin. And so one of the reasons that could cause swelling is if the cells on the back of the cornea don't work like they should, because it's their job to pump water out of the cornea back into the eye to keep the cornea thin and clear. In Fuchs dystrophy, these cells don't work very well and the cornea can become swollen. Also, in other people who have had cataract surgery or multiple operations on their eye, these inner layers may not work well and the cornea could become swollen. Along with the swelling, there can be blisters on the surface, and with the swelling it causes cloudiness and can cause unevenness on the inner layers that can interfere with vision. So also these people could benefit from a corneal transplant. The third main reason is if the cornea has an uneven shape. So particularly we can see this with keratoconus, where instead of the cornea being a nice round dome shape, it turns into more of a cone shape. This can cause astigmatism and distortion in the vision. Also, people who have had an injury or a scar on the eye, even if the scar is not very cloudy or not blocking the vision, the scar may cause an uneven curve on the front of the eye that can cause a lot of distortion, and they may need a transplant as well. There's other reasons, but these are probably the main ones. If you have any questions about corneal transplantation, please post. We'd be happy to answer them, and hopefully see you again soon next time on A State of Sight.